Hi there, this is Dr. Samantha here, going live again for another Q&A session. If you don't remember, my name's Dr. Samantha and I am the maternity mentor. Today we're going to be answering some of the questions that my viewers have left me from this week. Now, remember to check out our channel and we post every week, and please like and subscribe. All right. And just remember, if any of you guys here have any questions for me, please feel free to post them into the chat. All right. I'm going to go ahead and I'm going to get started. So I have a viewer here asking, I'm wondering if you're still recommending salmon in pregnant women's diets. My OB told me to stay away from it as it may contain high levels of mercury that can negatively impact my pregnancy. So this is a really good question, and this goes to diet in pregnancy. So salmon is one of those foods that normally we recommend in everybody's diet. But for pregnant women, it's important that you avoid mercury. And it is true that some salmon has mercury. So one of the things that I would say is, yes, it is still recommended to have salmon, but in limited quantities. Also, you want to eat not the farm-raised salmon, but instead fresh-caught salmon. Wild salmon contains far less mercury than the farm-fresh salmon that you might find. The other thing is you want to look for other sources of food that are high in omega-3 fatty acids, because those are extremely important for your baby's health and well-being. And again, remember, you want to make sure that you're eating this in limited quantities, so maybe once a week or less. The other thing is, if you go onto the web, you can find lists of foods that are actually high in mercury and should be avoided. So certain fish have lower contents of mercury and certain fish have higher contents. One of the ways you can also figure out how to do this, especially if you're a gestational diabetic, is you can go ahead and you can actually ask your OBGYN to refer you to a nutritionist that specializes in pregnant women. These nutritionists know a lot of the foods that are safe for your pregnancy, and they can go ahead and recommend the right types of fish for you. All righty then. Let's go to our next question. So I'm 19 weeks pregnant. My doctor prescribed 625 milligrams of co-amoxiclav. I'm so much worried. I'm afraid of taking antibiotics. So that's a very good question. So let's talk about antibiotics and infection. Most mommies are so afraid of taking anything when they're pregnant, and it's with good reason. It's very important to protect our babies, and there are medications that will cross the placenta and baby will get exposed to them. But antibiotics are extremely important if you've been identified as having an infection. So infections that are left untreated can lead to miscarriage, preterm birth, and even stillbirth. So it's extremely important that you get those treated. Now, before you take any antibiotic, you should ask your healthcare provider about the risks versus benefits of taking that antibiotic. In this case, the amoxiclav is safe for pregnancy. Now, once you start taking an antibiotic, that antibiotic will start to kill off the bacteria very quickly. So it's very common that 1 to 2 days after you start that medicine, you're going to feel better. You might even feel 100%. What you need to know is that you need to make sure that you finish the antibiotic, all of it. So one of the things I often tell my moms is this. Think about antibiotics as a weapon that kills off half the army, but half the army is still there. Now, that half, those bacteria, figured out how you fought that war. So what happens is they turn around and they build up defenses so that the next time you bring in that same weapon, it won't be used. It won't work well, sorry. That's antibiotic resistance. So what that means is if you stop taking your medication early, you will still have the infection and you will start to get the symptoms again. Only this time, that same medication won't work well and probably won't treat the infection, which means now you need a stronger antibiotic. And the stronger the antibiotic, usually the more risk there is to baby. And there are even some antibiotics that can only be given in an IV line in the hospital, and that requires a lot of intensive monitoring and can be worse for you and for baby. So if your healthcare provider is giving you something to take, you want to take all of it as prescribed. All right, so one of the things we have a lot every week are questions about bleeding. So I'm going to start to answer some of these questions, and we may find that some of the answers are very similar. One of the things you want to understand is that bleeding during pregnancy is something to be concerned about. However, some of it is normal. So we want to go ahead and just look at the scenarios. So my first viewer says, when I went to the washroom, I saw 2 drops of blood, and in the morning, 3 or 4 more drops, and then nothing else. Is everything all right? At 6 weeks, I also saw this type of spotting, but at my 9-week scan, everything was all right. Please tell me, what's the bleeding and spotting? So this is a great question. So when you see just tiny little spots, this is like a dot that you might see on your underwear, you might see on a pad, or you might see on tissue when you wipe. These little spots are usually benign. That means they're not really a big deal. So one of the most common causes of this type of spotting is actually tears or little cuts in the vagina. So the hormones that are necessary to have a healthy pregnancy will often thin out your vaginal tissue and the vaginal walls. And what happens is this makes them super sensitive. They can often become dry as well. So, for example, if you wipe too hard when you're going to the bathroom, you can actually cause one of those tears, and then you'll see a little drip of blood. Also, sex can be a cause of this. Now, if you see any blood, you always want to make sure that you let your healthcare provider know. Because another example of what could cause this type of spotting is an infection. If you have an infection of the cervix, this can cause irritation, which can lead to intermittent spotting. So you want to make sure that you always check in with your healthcare provider. However, this type of spotting sounds pretty normal to me. Now, the next question is, I'm a few weeks pregnant and I bleed a little, sometimes when I'm vomiting. I think it's the pressure, but it gets me worried each time it happens. So you're probably right. It probably is the pressure of you vomiting that's expelling some of that. And again, that kind of force could cause a small tear that's causing you to bleed. However, you definitely want to let the healthcare provider know. So one of the things your healthcare provider should do if you report any type of bleeding is they should assess you. That means they should check you out. They should ask you questions about what you've been doing. Did you recently have sex? Do you have signs of an infection? And oftentimes they will bring you in to do an ultrasound to check the baby, to check the placenta, and to check the uterus to see if there's any obvious signs of bleeding. So while this is probably another micro tear, it is something that you want to make sure you're addressing. Our next question, I'm 20 weeks pregnant with an MCDA twin pregnancy, and I am bleeding twice a day, sometimes light bleeding and sometimes a few drops of blood while urinating. After the USG, babies seem fine. The doctors can't identify the problem. What could be the reason for the bleeding? I'm so afraid for my baby's health or that I might miscarry. I was admitted in the hospital for 5 days. Okay, so there's a couple things in here that I want to address, some terms, okay? So first, this mom mentions MCDA twin pregnancy, okay? So what does that mean? MC is monochorionic. DA is diamnionic. So what that means is we have twins, two babies, that share one placenta but have their own sacs, their own like amniotic fluid bubbles, okay? So this is actually an extremely rare pregnancy. And this pregnancy, as this mom has probably already been told, will be an automatic cesarean section. And a lot of times these babies will be born very early to avoid any issues. So why is bleeding such a big deal with this mom? Well, those babies share one placenta. So if there are any placental issues, it is going to affect both babies. So the one thing we have to make sure when we see bleeding is the placenta working well? Because that's what's feeding your babies and that's what's taking care of your babies while they're in the belly. So one of the things that can happen is the placenta can start to move away from the uterine wall, and that can cause a little tear that bleeds. Sometimes also you'll have a little bleed that happens underneath the placenta and then clots off. That's called a subchorionic hemorrhage. While both of these things can be fine, normal, your pregnancy will proceed fine, you want to make sure that they're checked out by your healthcare provider. Now, the USG is a type of ultrasound, so they looked at the babies to see what was going on with them. Mom mentions that she would sometimes see a few drops while she was urinating. That most likely was just drops of blood coming out through the vagina, even though it was while she was urinating. However, you should always take a look at your urine when you are going to the bathroom in the morning, because if you have any blood in your urine, that's a warning sign of infection. Okay, so then the doctors couldn't identify the problem. What's the reason for the bleeding? They're not sure. So this again could simply be a tear in the vagina caused by sex or something else. And that's what's caused the bleeding. However, once you have those little tiny micro tears, they can't see that on ultrasound and they can't confirm that for sure. Now, being in the hospital for 5 days seems very, very appropriate. Again, this type of twin pregnancy is extremely rare. And you want to make sure that the doctor has a chance to look at everything, monitor the babies, and just make sure the bleeding doesn't continue. This mom can expect to possibly be admitted later on in her pregnancy for observation or possibly even inpatient stay as she gets closer to the due date so they can monitor everything that's going on. So just a reminder, you're here for the Q&A session. And if you have any questions, please feel free to put them in the chat. Our next question about bleeding is, we just found out my wife is pregnant, which was great news. We believe she is 3 weeks and a half based on her counts that the doctor gave us from her blood work, which was at 5,000. She started spotting brown for 2 days, not enough to fill up her pad. On the following day, she started spotting red blood and she had a small blood clot. Now we are scared because she did have a miscarriage the prior year. She still is testing positive on her test, so we aren't sure where the spotting is coming from. The doctors are taking forever to see her. So I'm really sorry to hear that this is happening, and I can understand how scary and frustrating that this can be. So what I would say to you, first of all, is one of the last comments made is that it's taking forever for the doctors to see her. So this is unfortunately very common. So one of the things that I will tell my expectant parents who suspect a miscarriage may have happened is to ask for a repeat blood test. If you get a repeat blood test and that blood test shows the levels are lower, you can assume that a miscarriage has occurred. Now, brown blood is old blood. So when you see brown discharge, you can assume that it is bleeding and you can assume that it is old. But just because you see old blood doesn't mean you shouldn't be concerned about it. You want to go ahead and make sure you're letting your healthcare provider know. Now, the next day, seeing the red blood, that's considered active bleeding. And so that you're aware, while we all know that active bleeding that fills a pad is extremely concerning, any bleeding during pregnancy is something that you should take seriously. Now, one of the things that's mentioned in this post is that there was a small blood clot seen and they were scared of miscarriage. So, one of the things that parents often ask is, what would I expect if I was to have a miscarriage? So, a lot of women will experience some bright red bleeding, not a significant amount, but a small amount, and they will pass some kind of tissue. Oftentimes, this tissue is described as a blood clot. This may or may not be the remnants of your pregnancy, your baby. Now, what you want to do is, again, you want to confirm whether you are still pregnant. So, what happens is when we first get pregnant, our HCG levels, which is a hormone that we have during pregnancy, they rise and they're supposed to continue to rise up. And so when we suspect miscarriage, we usually draw a blood test to see what's the HCG level compared to when mom thinks that she became pregnant. If those levels match, we confirm that a pregnancy exists, because oftentimes at 3-4 weeks, you can't see the baby on ultrasound. Now, if a miscarriage is suspected, what we then do is draw another level. If that HCG level is now coming down, that is a sign that the pregnancy hasn't maintained itself. Now, finally, with this question, I want to let you know a little bit about miscarriage. So, one of the things that I tell my mamas who have had multiple miscarriages is to ask their healthcare provider to test them for the MTHFR genetic mutation. So MTHFR is a mutation that, if it is present with you, means you cannot process folic acid the way everybody else does. So a lot of people are aware when you are pregnant, you need to make sure you're taking plenty of folic acid, because folic acid helps to prevent certain birth defects in babies. If these birth defects are present, it will often result in a miscarriage. And it's been found that a lot of women who have repeated miscarriages actually hold the MTHFR genetic mutation. Now, the nice thing about finding out about this mutation is that this mutation is easily treatable. So basically, all you have to do is take a special form of folic acid. Imagine it like this. If you go to get a soft serve ice cream cone and you have them cover that ice cream cone with the chocolate dip, that's that hard shell. Regular people who don't have the MTHFR mutation, we can just bite into that ice cream and get through the shell and into the cone itself in the ice cream. Okay? That ice cream cone with the shell is regular folic acid. For people with the MTHFR mutation, you guys can't get through the shell. And so you can't get to the ice cream, which is the important part. When you take L-methylfolate, that's like eating ice cream that doesn't have the shell on it. You can get to it faster and you can absorb it better. So one of the things you want to do is you want to ask your healthcare provider about testing you. It's a simple blood test that can be done in any regular laboratory. All right, so it looks like I have a question. So thank you, Beatrice. I'm going to answer your question now. So how do you diagnose placenta previa? That's actually a very good question. All right, so the placenta is the organ that feeds your baby. It kind of looks like a big circular brain, and it attaches to the side of the uterine wall. And it absorbs blood kind of like a sponge. So it pulls it through the uterine wall and feeds the baby through the umbilical cord. Now, most of the time, that placenta is going to attach on the side. Now, your uterus is a big U, and at the bottom is your cervix, okay? So this is the entryway or the cervical os that goes down to the vagina, okay? Now, your placenta should be up here or back here or over here. It should not cover the cervical os. When it covers that, we have a placenta previa. So how is that diagnosed? Usually by ultrasound. So usually nowadays, women will have 2 or 3 ultrasounds throughout their pregnancy. Most placenta previas, if they are asymptomatic, that means if you have no symptoms, are diagnosed at the anatomy scan, which usually happens around 16 to 20 weeks of pregnancy. Now, one of the things you should know is that oftentimes they won't call it a full placenta previa. They will call it a partial, or they'll call it a low-lying placenta previa. What that means is your placenta is kind of sitting not all the way across, but kind of on the side, okay? That placenta, as your uterus expands to hold a bigger baby, that placenta can move with the uterus and the placenta previa resolves. Now, some women get diagnosed by symptoms. And what's the symptom? The symptom is bleeding. The placenta is sitting over this opening. And even though when your cervix is closed, it still has this teeny tiny channel that always remains open to the vagina, because eventually that needs to spread apart to allow your baby to come down. So sometimes a little bit of stress, a Braxton Hicks contraction, even sometimes sneezing or something can cause a little tiny bit of blood to seep down through. And of course, remember, if you have bleeding, you want to go ahead and you want to tell your healthcare provider. And usually they order an ultrasound. And that's where they'll see your previa. Now, if you have a placenta previa, you can expect that you are going to be put into a hospital around 32 weeks of pregnancy, and they're going to start to monitor you and your baby continuously. Most placenta previas, as long as mom and baby are healthy, will be delivered early between 34 and 36 weeks of pregnancy. The reason for this is because you cannot have your cervix dilate at all when you have a placenta previa, not even a centimeter. Because once you open up enough, this placenta starts to bleed through. And that can lead to anemia in your baby, and it can potentially lead to death if left untreated. So you can expect to have a C-section around 34 weeks. Thank you for that question, Beatrice. That was a great question. All right, so our next question that we have comes from a viewer who says, I am 24 weeks pregnant. Yesterday, I passed a large blood clot and panicked. The doctor said I was 1 centimeter dilated. They gave me an injection and they said that the ultrasound was normal. The cervical length was 3.4. They sent me for bed rest. Today, I'm still bleeding. What should I do? So first things first, you call the doctor, 100%, absolutely. Because if you're still bleeding, they want to know. They should be asking you how much, what color is it? Are you having any other symptoms like pain, fever, contractions, anything like that? That shot that she received was most likely a progesterone shot, which is designed to hopefully stop preterm labor if it's happening. So some moms, especially at the 20-week gestation, can have silent contractions. So the uterus can be irritable or even having some Braxton Hicks, and she won't feel it. But those types of contractions can cause the cervix to dilate and open up. So as a result, that can cause some bleeding. Now, the best thing to do, again, is follow the doctor's advice, do the bed rest, and call. The other thing I want to let you guys know is she mentioned cervical length. So cervical length is, again, literally the length of the cervix. So when you are early in your pregnancy, your cervix should be long and thick, okay? And as you get closer to having the baby during labor, that cervix shortens and thins out. That's what's called effacement. So one of the things they worry about when they think that there's preterm labor happening is what's the length of the cervix, and do we have a mom potentially going into labor? So the fact that it was 3.4 centimeters sounds pretty good. If they were to do a repeat ultrasound and found that it was 3.1 centimeters, that could just simply be a slight, miscalculation on ultrasound. But if they were to find that now the cervix was 1.4, let's say, that could be a significant finding showing that you are progressing and that they need to monitor you more closely. All right, so I'm a 9-week pregnant woman on my period, my due date. Sorry, I'm 9 weeks pregnant and got my period on the due date, I think is what she's saying. She started to have brown discharge and light bleeding. She's worried. She says, what can I do? I'm still sick, hungry, and with a little bit of pain. So I think what I'm getting is that when her next period was due, she started bleeding at that time. So women can have 1, 2, or 3 more cycles of their period while they're pregnant. However, you definitely want to check it out and make sure there's nothing else going on. One of the things that I will say about this, again, brown discharge is old blood, light bleeding is something to definitely take seriously. But she mentions, I'm sick, hungry, and I have a little bit of pain. We definitely don't want to see pain with bleeding, okay? Pain, especially abdominal pain, can be a sign of infection. So normally we do associate early pregnancy with sickness, with morning sickness, and nausea and vomiting are kind of common. However, pain is not. And if you have nausea and vomiting associated with abdominal pain, that is definitely a sign of a potentially serious infection, and you need to head to a hospital to get it checked out. All right, so our next question. I'm pregnant with twins, and the last 5 days was bleeding twice a day. Yesterday, they did an ultrasound. The cervix is closed. The doctors don't know where the bleeding came from. How can I stop the bleeding? Unfortunately, you can't. If they don't know the cause, there's no way to stop the bleeding. Now, I'm hoping that one of the things your doctors told you to do was to slow down. So let's talk a little bit about bed rest, which we often hear about when we have bleeding. Bed rest is actually not as good for us as we think it is. So bed rest can actually lead to some different issues for mom. For one, it can lead to risk of pneumonia, because if you're laying in bed all the time, you're not expanding your lungs, which is needed for you to go ahead and be healthy. Also, mothers are at increased risk of blood clots during pregnancy, and laying around doing nothing can increase that risk even more. So bed rest is not always recommended anymore. However, if you are experiencing a high-risk pregnancy like twins, you want to make sure that you're taking it easy. Too often, our lives are super busy. And as a result, we're just going, and doing. And we don't stop to think about asking for help. When you are pregnant, you need to ask for help. So in this mom's case, what can you do? You don't want to be lifting any heavy items, okay? So anything heavier than like 5 to 7 pounds, you should be asking other people to help you. So the example I give a lot of people is, you can do the laundry, but you shouldn't be carrying the basket. So somebody should carry the basket for you to the washer and the dryer. You can put stuff in, switch stuff over, and then they should carry it back for you, and you can fold and put stuff away. You can cook. However, you shouldn't be standing on your feet for an hour. So you want to try to plan your meals so that you can cook in small increments, like 20, 25 minutes. You can go to the grocery store, but you want to try to see if somebody can carry the stuff put that into your car and also carry it into your house. Okay. You don't want to be straining to reach for stuff. And speaking of straining, another common cause of bleeding is when you strain while going to the bathroom. So when you are pregnant with a high-risk pregnancy, you want to avoid constipation. So when you're constipated, this ends up causing you to need to push really hard in order to go to the bathroom, and that can cause bleeding. So you want to make sure you're drinking plenty of fluids, eating plenty of fiber. Natural ways to help reduce your risk of constipation is to use apple juice or prunes or prune juice. All right. Now, additionally, you can usually take a stool softener that you find over the counter, like Colace. Colace is not a laxative. Do not use laxatives unless you are directed to do so by your healthcare provider. All Colace does is it helps draw fluid into the colon so that your poop is soft and it will come out easier. Okay, laxatives contain medications that stimulate you to go. Those same stimulant medications can induce contractions. So do not use a laxative. If you're unsure of what product to buy, ask your healthcare provider, what do I buy over the counter? So those are some of the things that you can do to help prevent the bleeding. Okay. So our next question is about blood pressure. Now, before I continue, I just want to remind you, you're here for my weekly Q&A. If you have any questions at all, please type them in the chat box and we'll definitely try to get to them. So this is Dr. Samantha, the maternity mentor. And remember to like and subscribe the channel. We really look forward to hearing from our viewers, and this is something we enjoy very much. So our next question is about blood pressure. So I was prescribed labetalol 100 milligrams 2 times per day and a baby aspirin at 25 weeks for high blood pressure, which was 150/89. The next week, the prescription increased to 3 times a day. Monday, at my 28-week appointment, my blood pressure was still high, but went down to 139/79. The doctor put me on Procardia XL once daily and lowered my labetalol to 2 times per day. Is this safe for me and the baby, considering my blood pressure isn't severe? I did a 24-hour urine test, and there was some protein in my urine. He said it should be under 300, and mine was 372. Does this mean I have preeclampsia? I have no swelling or other symptoms. This is a fantastic question. So, for starters, any blood pressure that's 120/80 is high, okay? Don't mistake this at all. 121, we now consider to be a high blood pressure. Now, obviously, this needs to be something that is consistent and not a one-time thing. Blood pressure is extremely serious. When you have high blood pressure, it affects the blood flow to your baby. It causes your placenta to eventually stop functioning, and this is why it is monitored so carefully. Additionally, if we allow blood pressure to get too high in a mother, she can have a seizure. When you have a seizure, blood flow is also stopped to the baby, and that's considered a medical emergency, and an emergency C-section will usually be performed. So we want to make sure we do everything in our power to keep the blood pressure at a reasonable level. Now, the other thing you need to realize about blood pressure is sometimes we hear these numbers that our family members have had that we heard on a medical TV show that are high. So I'm going to be ridiculous here, 200/110. And everybody's like, oh my God, that's so high, right? Well, for you, 150/89 might be equivalent to that. That might be for you the same thing as 200/100 for somebody else. So you got to understand, we're not all identical. We're not textbooks. We're not pieces of paper. And so as a result, our healthcare providers, we're trying our best to gauge what works for you. We also don't want things to get out of control too fast. So I've definitely seen labetalol used 3 times a day. I can tell you that I've seen it used 3 times a day, and I've seen it used every 8 hours. I happen to think that every 8-hour dosing of labetalol is actually better because when it's spaced out, it works better. Procardia, which is nifedipine 30, is actually a great medication. That XL means that it lasts extra long, or it's an extended release, however you want to look at it. But basically, one pill will last you for 24 hours, okay? And then you need to take it the next day. One of the advantages of Procardia is that it can also actually help with contractions. So it will actually stop contractions for some moms. So that's a really big advantage. And then lowering the labetalol makes sense to me. So labetalol can actually be used later on if you do develop preeclampsia as an emergency medication that they deliver in your IV. Okay, so lowering the labetalol now allows for them to use more later on. And that's why a lot of moms will be switched over to using both medications. Now, what's funny is your blood pressure is still pretty high, okay? The last blood pressure you put in here is 139/79. That's still pretty high. But believe it or not, your doctors are not going to aim for normal blood pressures because at a certain point in time, your body and your baby get used to the slightly higher pressure. So it's a balancing act, which is why they'll often send you to a specialist. Now let's talk about 24-hour urine tests. So a 24-hour urine test, for people who are not aware, what they do is they have you go ahead and they have you pee for 24 hours. They give you a little bucket to pee in, and then you pour it into another bucket. and you collect everything for 24 hours, and it's sent to a lab, and they measure it to make sure you're peeing the right amount, and they check it for protein. So when your kidneys are not working right, protein spills into your urine. It's not considered normal. And when our protein is there, we start to worry about what else is going on. What disease process is causing this? And one of the things, as this viewer mentioned, is preeclampsia. So preeclampsia is basically the lead in to eclampsia, which is a syndrome in which your body stops, your kidneys stop working right, your liver enzymes elevate, and it leads to critically high blood pressures that can lead to seizures. So once a mom starts to show signs of preeclampsia, she's usually placed in the hospital under observation. Baby is monitored for growth and for heart rate, and we try to treat mom for as long as we can before we go ahead and try to deliver the baby. Now, preeclampsia can turn into eclampsia like that. I have worked in the hospital in the past. I've gotten in. I've received a patient at 7 a.m. And by 9:30, 7 a.m., she's normal. And by 9:30, we're having an emergency C-section. This is why we take these things so seriously. You never know when it's going to turn. You never know when it's going to change. This mom mentions she has no symptoms and she has no swelling. So that's awesome. That's a really good thing. But you need to make sure that you understand how serious this can be. It is better for you to take all the medication and monitor yourself carefully. Now, some of the symptoms or warning signs. First thing is headache. If you get a headache that doesn't go away, you do not want to ignore this during pregnancy. You want to go ahead and take your blood pressure. You want to write it down, and you want to let your doctor know what's going on. The next thing is visual symptoms. So when we have high blood pressure or preeclampsia, a lot of times moms will have these weird visual symptoms. So they may have floaters, which is like where you can see these things. They're like spots or dots in front of your eyes. Some moms might get tunnel vision where things kind of go narrow. You might get bright flashes in front of your eyes. Your vision may become blurry. Anything visual, even if you do not have a headache or anything, you want to let your doctor know. And finally, another symptom that a lot of moms ignore because they assume it's heartburn is pain up top. Okay, I'm going to stand a little bit right up here. Okay, so that's epigastric pain. And most moms who are pregnant, they assume that that is heartburn because moms have heartburn when they're pregnant. But if you have epigastric pain, which is pain at the top of your belly, especially if it doesn't like go away, even when you say like drink some milk or take some acid medication, you don't want to ignore that. That could be a warning sign of something else going on. All right. So you want to let them know. Now for swelling, a lot of people, they have swelling, but what ends up happening is they don't see it right away. So we look for swelling in the hands and the face, and we're waiting to see it. But if you actually are starting to have signs of the high blood pressure and potential preeclampsia, I would recommend that you weigh yourself every day, because sometimes that water weight, you'll start to see it on the scale before you see it in your body. So if you go ahead and weigh yourself daily, you can actually potentially notice it before you see it. So I think that answered most of it. And I see that I have a viewer. Hi, Mary. I think Mary's one of the nurses I worked with in the past. I hope you're doing well. Let's go ahead and answer our next question. So this is about C-sections and vomiting. So I'm about to start my surrogate journey, and the doctor told me I will be delivering through a C-section. So she wants to know what happens if she's vomiting forcefully. She remembers when she donated some of the eggs that she came out of the surgery room throwing up. And this viewer comes from Nigeria. So welcome, welcome. So what I want to say to you guys is that unfortunately, nausea and vomiting is actually common both with C-sections and with vaginal deliveries. But as anybody knows who's had a C-section, you've got a surgical incision, which means you're in some pain, okay? And so throwing up while that's happening is just awful. So And unfortunately, some of the homeopathic treatments we use, like say ginger, we can't use while after you've had a C-section because you need a little bit of time to rest your stomach. So first things first, tell the anesthesiologist up front. The anesthesiologist is the healthcare provider, usually a doctor, but sometimes a nurse anesthetist, who is administering the medication that helps prevent pain during the surgery. Okay? They can give you medication in your IV that you do not need to swallow that will help with that nausea and vomiting feeling. Now, a lot of times we also have patients take something called Vicitra, which is this honestly, it's really kind of gross medication that you kind of just drink all in one shot. It tastes kind of like a really sour candy, but that helps to reduce acid in the stomach, which can help prevent some of that nausea and vomiting. Okay. So you want to go ahead and you want to, ask them for stuff like that. Now, after you give birth, a lot of women are hungry. So they oftentimes don't feed you for 12 hours or more leading up to the surgery. So you come out, you're feeling okay. They've given you medicine in your IV and you're hungry. Okay. And guess what? If you put too much food or even drink inside your stomach right after that C-section, you are going to get sick. So when the nurses tell you to go slow, when the doctor tells you to go slow, because oftentimes the anesthesia creeps up on you after the fact, and the next thing you know, you're throwing up. Okay. In a couple hours, a lot of that is going to wear off and you're going to feel a lot better. One of the most common medications that I like to use for nausea and vomiting after a C-section is Zofran. So ask if that's available where you're at. All right. Next up is depression. I'm on Effexor and I'm 6 weeks pregnant, and I'm wondering, should I wean off the medication or is it safe to take? So this is a fantastic question. So one of the things that I'm going to say about this is that all of us providers, we actually have access to resources that help us make these decisions. And one of the things you need to know is that a lot of these things should be referenced. So you cannot do studies on pregnant women about any medication because it's not ethical. Because what if it is bad? Then it could hurt the mom or the baby. So as a result, all of our information about antibiotics, blood pressure medications, cholesterol treatments, everything, seizure medications, everything is done based off of anecdotal reports that physicians and patients will report after they're done being pregnant. Now, one of the best guides in the world is by Thomas Hale. And he actually has the infant risk line, which is available for everybody across the world, where you can call in and speak with providers who can go ahead and give you some guidance. Now, they are not going to give you 100% recommendation, but especially for medical providers, they can allow the medical provider to ask further questions. Thomas Hale is a pharmacist. So one of the things that he has done is he's also collected data like how much of the medication gets into the bloodstream. How fast is it there? How long before it's gone? Is it a big molecule? Is it a small molecule? So it's very complex, but this is the type of information that your healthcare provider should be looking at. So then they divide it into categories. And what I'm going to tell you is based off of the research that we've seen from looking at studies, Effexor is safe for pregnancy. Now, one of the things that a lot of women say is that even though they hear it's safe, they're still very worried. So if you are still worried despite this, you do need to wean off, and you need to wean off under a healthcare provider's guidance. It does not need to take 3 months to wean off. It can take just a couple weeks, but you need somebody on your team and on your side to help monitor your symptoms and be there to re-prescribe if it's needed. Now, you also want to ask that provider about any homeopathic remedies that you may be able to use. For example, you may be able to boost your mood a little bit with some vitamin B12 in the mornings. Or if you have some anxiety, you may be able to use vitamin B6 to help with that, or maybe even a little bit of magnesium. So it's important that you're working with somebody while you make these decisions. Now, the final thing is that untreated depression or anxiety can lead to significant adverse outcomes with your baby. If you have untreated anxiety or depression, it can lead to miscarriage. It can lead to a baby that doesn't grow properly. It can lead to babies who have almost like a withdrawal syndrome where they're very irritable at birth. They're very inconsolable. They'll be poor feeders. They can have low blood sugar, and it can lead to a preterm birth. So now you're having a premature baby. So it's very important to weigh the cost and benefits when you're deciding whether to stay on your depression medication or not. All right. So our next question is about pacifiers. So this comes, I think, from a dad, and he says, my son is 2 months old and we are not using a pacifier so far. The milk is not enough, so we are supplementing with bottle feeding. We did not introduce the pacifier to avoid further confusion for him. Should we introduce the pacifier? So the answer is yes, a resounding 100% yes. So I am a lactation consultant, very familiar with breastfeeding and formula feeding. I've been a lactation consultant for over 10 years, and I am totally pro formula and pro pacifier. So the pacifier specifically, why do we introduce it? So pacifiers have been shown to reduce the risk of SIDS, which is sudden infant death syndrome, in infants. So the idea behind it is that when your baby has something to actively suck on while sleeping, that keeps the baby in a slightly lighter state of sleep. Okay, so unfortunately, after we have babies, we become sleep deprived, and chasing sleep is what every new parent is doing. But the reality is, with SIDS, part of what we think is going on is babies are basically too comfy and they're sleeping too well. And we don't know why, what happens next for them to pass away, but it starts with that. When we breastfeed our babies, it's a lighter, thinner milk than formula, so it digests faster. So babies wake up more often to eat, which they think is part of the preventative nature. The other reason, for example, why you see the recommendations of babies wearing light sleepers and not heavy blankets or heavy sleepers is because if the babies get too warm, that can also lead to some issues. So when it comes to pacifiers, letting that baby actively suck on something can help keep them in that lighter state of sleep, which keeps them more aroused and breathing better. Okay. Now, a lot of parents will say, oh, but I don't want my baby using a pacifier when they're a toddler. So I'm going to tell you that taking away the pacifier is pretty easy. You take it away. It's harder on mom and dad than it is on the baby. You will have a baby for a day or two who is very upset with you, and then they'll forget about it and they will move on. So as far as having a toddler who has this pacifier forever, this is something that is very manageable. Now, in this case, we have a 2-month-old baby. So you may not be able to introduce that pacifier. Your baby may not take it at this point. You just have to try and see if they're interested or not. If they're not, it's not the end of the world, but it certainly can help. Now, when should you introduce a pacifier for those of you who are thinking about it? The American Academy of Pediatrics recommends that you introduce a pacifier after breastfeeding has been established and is going well. That is usually approximately 2 weeks of age. So after 2 weeks of age is a good time to start thinking about whether you're going to use a pacifier depending on how things are going. Now, if you choose to formula feed, which is totally fine, you can introduce a pacifier right away. It shouldn't interfere with your baby formula feeding properly. All right, remember guys, as we're kind of getting close to the end, if you guys have any questions, please feel free to put them into the chat. All right, so I'm 38 weeks and 6 days pregnant. The doctor told me that I'm dilated 1 centimeter, and they told me that when I was 37 weeks and 5 days, and asked me to get admitted starting at the 39th week. This is my second delivery. The first baby came at 38 weeks and 3 days when her water broke. She's wondering, how can she check her progress of dilation at home before going to the hospital? She's not feeling any kind of contractions other than like a light cramp or kind of tightening, which is less frequent, which to me sounds like Braxton Hicks contractions. So ultimately, you cannot check your dilation at home, nor should you try. One of the things that you may or may not realize, first of all, when your doctor is checking your dilation, they use their fingers to kind of come up through the vagina to see if they can feel the cervix and how open it is. And they're doing that with a gloved hand. What a lot of people don't realize is that that glove is sterile. And when she's doing that, or he, I'm sorry, when your provider is doing that, they are doing a whole bunch of stuff to prevent infection. Again, remember, we do not want to develop an infection during pregnancy, no matter where you're at, because it can be life-threatening. So you cannot stick anything in your vagina at all to try to check this. You want to keep your vagina as clean as possible. One of the things you can do if your healthcare provider has approved it, you can take short walks. Ask your healthcare provider if you can bounce on an exercise ball. That can sometimes help with stimulating contractions and helping with dilation. And another thing is, once you reach 39 weeks pregnancy, you can ask your doctor if you're allowed to use your breast pump. Pumping your breast can actually stimulate your colostrum. And if you get me, you can save it for your baby. But also it can help stimulate uterine contractions. But remember, you do not want to do anything prior to 39 weeks. Even though it may seem like you are ready to go at 37, 38 weeks, your baby is not. There's still a great amount of brain development that's happening in those last couple weeks. So, hi, Mika. Welcome. So Mika is telling me she's 38 weeks and she was dilated 2 centimeters. She's having cramps and strong, sharp belly pains and pressure. She's trying to hold on because her daughter's turning 7 tomorrow. Oh my gosh. Good luck, Mika. So you probably want to call your healthcare provider and let them know what's going on, because a lot of that sounds like the signs of early labor. One of the things you can do, Mika, is drink plenty of fluids. So one of the things that can cause contractions and significant contractions is dehydration. A lot of moms, we try to avoid drinking fluids because we're already peeing every 5 minutes. So the more you drink, the more you're going to use the bathroom. But you want to make sure that you're drinking plenty of fluids, because that might actually stop some of that. Okay. Now, the other thing is some of that cramping could be needing to use the bathroom. So if you feel like you're constipated, maybe drink a little bit of prune juice or something like that. 7-year-old birthday, that's a big day. If you have a party planned, try to figure out who in your tribe, your friends, your family can help you take care of that party and any arrangements, because the less you're running around, the more likely you can hold on. However, again, I would be contacting your healthcare provider tonight and let them know what's going on, because it does sound like you might be in early labor. Good luck, Mika. Congratulations. All right. So we have a question about urinary tract infections. I'm 41 weeks pregnant without any labor symptoms, and my urine is pure reddish every time I urinate. My doctor advised me to drink plenty of water, which I have been doing for over 5 weeks now. What can I do? So you need to ask your doctor to send you to a kidney specialist or a urologist, which is like a urinary specialist, okay? If you're not testing positive anymore for urinary tract infection, you want to make sure that you're getting this checked out. You should not be seeing a reddish color in your urine, so they need to investigate that further. One of the other causes of that can actually be your muscle breaking down, and you see it coming out in the urine. And if that's the case, it's called myoglobin. And if you see myoglobin in the urine, it can actually lead to kidney failure if it's left untreated, because it starts to clog your kidneys up. Now, this would be extremely rare, okay? This is not a common occurrence. But again, red urine, not normal at all. So if your healthcare provider is unable to diagnose it, which can happen despite all the tests they run, then it's time to see a specialist, okay? The other thing that your doctor should be doing is doing an ultrasound, probably even weekly if they need to make sure no bleeding is present that's causing that red urine. Okay, I have a question about yeast infections. I am 9 months and 2 weeks pregnant. I have vaginal discharge, which is yellow colored. The doctor has suggested that I put a tablet, Candid, inside my vagina. Is it safe to use, and are there any side effects? My delivery date is near, and she's confused about the symptoms. So, a couple things. So, yeast infections are very common during pregnancy. They can occur at any time. We do like to get them treated even if it's at the end of your pregnancy because it can cause some issues. One of the issues that yeast can cause is not necessarily with the baby, but once your water breaks, that yeast infection could turn into a uterine infection, and that could lead you to needing a C-section. So if we can get that treated before you even go into labor, it's better for you and baby. As far as a tablet, that's one of many forms of yeast infection medications. Yep, it is absolutely safe. There's nothing wrong with that. The only thing I am going to tell you is I just told you guys, don't put anything in your vagina. Well, this is, I guess, an exception to that. When you go ahead to insert that, usually they come with an applicator, but a lot of moms find that very awkward and clumsy, and they end up using a finger sometimes. So what I want you to make sure is that you're going ahead and washing your hands very well prior to using the medication, just in case you need to use a finger. The other thing is with any infection, especially an infection with discharge, you want to make sure that you're being very clean. So make sure you're always wiping front to back. You want to change your underwear a couple times per day, especially if it's getting at all damp. If you use a pad, change the pad every single time you go to the bathroom, even if you don't see a lot of discharge, because all of these things are going to help prevent the infection from getting worse. We're almost done here. Again, if there's any last minute questions, feel free. My last question is about subchorionic hemorrhage. So during the 11th week of my pregnancy, I had heavy bleeding with clots. So this viewer went to the emergency room. They did a blood test and an ultrasound, and they said the baby was normal. She reports that she had bleeding 3 times every now and again, but everything has always been normal. At the 12-week Down syndrome scan, they found some bleeding near the baby's skull. They said it was a subchorionic hemorrhage. My family doctor sent the report to the specialist, who said they would call me. Will they give me any medicine or injections to cure or help? So subchorionic hemorrhages are actually very common. They're oftentimes found during an ultrasound, sometimes because you have been bleeding and sometimes by chance. There is no medication or treatment that they usually give you. So this is basically a little bit of bleeding underneath the placenta, okay? It often resolves on its own. It will oftentimes be seen on the ultrasound getting smaller and smaller and smaller, and will reabsorb eventually into the body. Sometimes they'll heal into a clot and it just stays there until you deliver. They're usually very benign unless you continue to bleed over and over. So usually the best treatment is just to rest and watch it. Now, rest does not mean bed rest. Again, bed rest is not always good for us pregnant women. So what it means is no heavy lifting, take it easy, don't strain yourself, stuff like that. All right, so that comes to the end of all of our questions. If there are any other questions, please feel free to type them in. Again, I'm Dr. Samantha, the maternity mentor. We are starting up these live Q&A questions, and our goal is to try to have them once a week, hopefully on Mondays at 9 p.m. Eastern Standard Time. So if you have any questions on any of the videos, please feel free to leave those comments. And remember, it would be great if you can like and subscribe to the channel. I really appreciate your support. And I am so grateful that you are here. Thank you so much, Mika. Good luck. I wish you one more day of pregnancy. So you can eat some birthday cake. Maybe you can go to the hospital right after you blow out the candles with your daughter. I hope everybody has a great night. Thank you all for joining me. And thank you so much for supporting me, the maternity mentor. Have a good one, guys.